But if they're in the emergency room and they're under observation, it's outpatient. It's Part B. So that fundamentally means that if they didn't take Part B, they have no coverage. Guess who's eating the entire bill? That person that went there, whether it's a veteran, as you mentioned, it could be anybody. A civilian that goes to the ER and they don't have that coverage in place, they're eating the whole bill.
Mission 65.
Get this right.
Medicare retirement, your plan.
Mission 65.
You deserve it. Mission 65.
Let's get it right.
If you serve this country and you're turning 65, this is the episode for you. Every week I sit down with veterans who have VA benefits and assume that they're covered. And every week I have to explain the same thing. VA benefits and Medicare are two completely separate systems. One does not replace the other, and if you miss the window to enroll in Medicare, the penalty that you're stuck with is permanent. Today, we're going to walk through exactly what VA covers, what it does not cover, why most veterans need Medicare, even if they've never thought about it before. And we're going to talk about the one scenario that changes everything. If you're a veteran turning 65 or you know one, this is the conversation that should have happened before the Medicare card showed up in the mail.
So, Glenn, veterans come in all the time talking about their health coverage they have through the VA and thinking that it works kind of like health insurance card would, that they can just go anywhere they want, when they want. Why is that a dangerous assumption to make?
It's a great question, and it is a very dangerous assumption because the VA's healthcare, even though you get issued a healthcare ID card, it is not a traditional insurance card. It's a very heavily managed network, and it applies specifically to VA healthcare, meaning you're not able to just go outside the VA to get the care that you're looking for. You're actually required to get your care at the VA, and that's what the VA will cover. But there's a bunch of other nuances involved with that as well, where, depending on their situation, they may not even be able to get care not related to a service-connected disability through the VA. There's a bunch of other factors in there that can play into it, but ultimately it could result in dealing with a lot of out-of-pocket costs if you don't plan or prepare accordingly.
So how would somebody plan accordingly? I mean, that would probably be the next logical question, right? So there's an issue that could happen if somebody doesn't plan properly. What does proper planning look like?
Education, information, getting it in advance before you ultimately run into those problems. In the Special Forces community, they have a saying that you don't prepare for the emergency during the emergency. You prepare in advance.
Yeah.
And it's the same principle. You just apply it to this specific situation and how you get your health care. So it needs to be done in advance. And if you don't know, you need to figure out what you're supposed to do.
But preparing in advance, you say education and information, right? Let's be honest. There's a ton of information out there. I mean, at this point, somebody can go to Google and ask it a question, and they're going to get a bunch of different answers.
Correct.
And a lot of people do. They'll ask Google questions they wouldn't ask their spouse or significant other.
That's true.
And they're going to end up with a bunch of different responses. So the point being, where can somebody go, or where should they go to get accurate information? Because that's the problem, right? There's no shortage of information or education available out there. There's almost too much. Correct me if I'm wrong. I mean, it seems like there's just everywhere you look, there's stuff being thrown at people. And I think, how does somebody sort through that and figure out fact from fiction?
That is a great point. We do live in the information age. And the simple answer would be, it depends on the information that you're looking for, right? Something related to the VA's healthcare system, obviously the best resource is going to be the VA. Problem with that is, though, there's a lot of other factors that come into play that is outside of the VA's purview. And you have people that work for the VA giving advice on things that they don't actually understand. So to your point, you can't just go and expect the trusted resource to know everything about everything. You're going to need to find somebody that actually specializes in that field to get the information that you need.
I think what you're saying ultimately, though, is that, so if you go to the VA and you speak to somebody there, VA is a separate program, VA health benefits, from a system like Medicare or a system like Affordable Care Act under 65 coverage. It's totally separate. They don't intermingle. There's no crossover.
Right.
And so you can have somebody over here that really probably has the best intentions for the person they're speaking to. They want to do right by them. They want to help them. And they feel like they probably are, because they have a little bit of information they've gathered from here or there, right? Maybe they did a Google search.
Oh, yeah.
And so they're giving some advice this person should then take and now act on that could cause issues because it might not be accurate.
Right. Exactly. It's very true. We've seen it time and time again where the VA's advocates have given incorrect information to veterans about their healthcare situation, and it would have resulted in them being penalized had they not gotten the accurate information that they needed. It is two totally different systems. And again, while they may be best intent or they have the best intentions, it's not necessarily going to be the right information for them.
So because of that, so getting resources or information on VA health benefits itself, get that through the VA, right? And let it stop there. Don't let it cross over. But if you're being offered a program like Medicare and you have a decision to make about that, what you're saying ultimately is a person at the VA is not necessarily going to be the most informed, educated, or even experienced person at handling unique situations when it comes to that, right? Because Medicare is very unique based on each individual's situation.
That's correct.
Right.
Yep. It is very unique.
It's not a one size all fits all type of program.
Yep.
Right.
And honestly, the same principle applies to the VA as well. Veterans being able to get their health care through the VA, it's individualized. There's a number of factors that they look at to consider whether a veteran is eligible for health care through the VA. So yeah, Medicare is no different at all. It is something that affects everybody differently, and they need to make sure they're getting the proper information on both.
So where somebody potentially is considering doing something with Medicare, not doing something with Medicare based on their rating at the VA, that can depend on what they should do with their Medicare coverage. Ultimately, what I'm saying is there's all these different levels of ratings is what you're saying. Disability ratings at the VA, income limits, things like that could affect what benefits they receive. Right. And so somebody that says, well, I talked to my friend and he goes to the VA for everything, or a family member or somebody that they esteem, that person could have a completely different situation than them, right?
Correct.
And now they have a lens they're looking through that's just distorted, right?
Yep.
So that's interesting, and we see that so often. We've seen people almost make decisions that could have impacted them negatively. Fortunately, been able to help you and your team, a lot of people. That being said, great question I want to ask you is, so if a veteran does end up, let's say in a civilian hospital, and they don't have Medicare Part B, what actually happens to the bill in that case?
That's a great question. Again, it's going to be dependent on that veteran-specific situation. But if it's not handled correctly or properly, they are going to end up getting stuck with that entire bill. I've seen it happen many times. It's a tragic situation to find yourself in, but a very real risk if, again, you don't have the proper information in advance. As far as filing claims in an appropriate amount of time, are you even able to get care outside of the VA? It's just a number of factors that can apply. But ultimately, they may end up getting stuck with the entire bill.
Yeah. So another question for you then would be, and we've seen this all the time. I know you've seen it. Your team has seen it. Everybody's seen it very often. But let's say a veteran has VA health benefits, and they feel like, hey, I'm good with what I have. I've been going to the VA for a long time. I like my care team. I like the facility. Everything's been great, and I want to continue doing that. And they decide at 65, you know what? I'm not going to enroll in Medicare Part B. And there's multiple reasons why they potentially wouldn't want to do that. We can maybe talk about that and unpack it a little bit. But what happens when that clock runs out? And the clock being, the period of time they have to enroll in Medicare. What happens when that phases out and they just go beyond that?
It's a great question. It's a very great question. We see that situation happen all the time with veterans. They come in thinking, hey, I've got the VA. I don't need healthcare. And maybe they got information from the VA themselves. What actually ends up happening, though, is the VA's healthcare is actually not considered creditable. So in layman's terms, it just means Medicare doesn't view the VA's healthcare as adequate, which ultimately means if they don't enroll when they're supposed to, the veteran is going to start accruing a penalty. It's called a late enrollment penalty, and it actually will build up and compound over time the longer they go without it. The problem is that penalty is permanent. So that means a decision or a decision without the proper information could ultimately lead to thousands of dollars in penalties that they're stuck paying for the rest of their life.
And I've got to ask, well, then why? The question always, the next logical question is, well, then why would somebody consider not taking Medicare Part B, right? They go to the VA for everything. They're happy. Why wouldn't they just take Medicare as a backup?
That's a great question. That usually comes from the cost. So there's a cost associated with
pay.
Medicare, and that's why most veterans don't want to enroll in it. That's the majority of the reason. Or they've been given false information, told that they don't need to have it. And the truth is, as I've already mentioned, it's not creditable coverage. And if, depending on their situation, they don't have anything else in place, they could be dealing with a real penalty for the rest of their life. And so the biggest reason why we see them avoid it is it's all about cost. They don't want to pay the additional price of having Medicare. It's really what it comes back to.
And everything does have a cost, right? Every decision that we make does have some sort of a price associated with that decision,
Yep,
right?
there's always a cost. We just may not realize it until later on down the road.
And so, correct me if I'm wrong. I think there's I've had a lot of stories, but one in particular that kind of comes to top of mind, and I'm sure that you remember it as well, as the gentleman, who, like many people we've talked to, go to the VA for everything, and I believe he was 100% P&T, and said, you know what, I don't want Medicare. I'm not going to take it at 65, and makes a decision, I'm just going to go without it. Happy with his care team, happy with everything that was, going on at the VA at that time. And then can you speak to that a little bit? What ended up happening to that individual, and why would a veteran end up maybe having to change that decision down the line they made? Right?
Yep. It's a great question. And one of the things I want to highlight is that you said at that point in time. They were happy with their health care at that point in time. Problem is VA's turnover for healthcare professionals, their staff, it's very, very high, their turnover rate. So it's changing. It's a revolving door in many cases. So while he was happy with it at that point in time, he didn't see any need to have Medicare as a backup. But the problem is, years down the road, the PACT Act got passed. Millions of veterans ended up getting access to the VA that didn't have access before.
And that's what the PACT Act did.
It did.
Correct.
It opened up, exactly. It opened up the VA to veterans that weren't able to get health care there before, veterans that were exposed to toxins and chemicals and all these other issues that weren't recognized before. And that caused an influx into all the VA facilities. And so at his local clinic, the wait time started to get longer and longer. And the problem is as he got older, I believe about 75 when he came to us to get help, he had been diagnosed with a condition that required him to get health care consistently. Like he had to go in for treatments almost every week. And with the wait times getting longer and longer, he wasn't able to get in a timely manner. So he had to look at an alternative. And he thought that, well, I'm eligible for Medicare now. He went back and he enrolled. And to his surprise, he ended up getting penalized well over $400 a month.
That was the price he had to pay. With the penalty included in there. Okay.
Yep. So not only did he have to pay the base premium, he doubled it because he went almost 10 years without that actual Medicare coverage where he didn't have creditable coverage. And now he's stuck dealing with that for the rest of his life. Why? Because he needs that health care. Right?
Yeah,
he needs
so
to be able
the
to
price
get care
to
elsewhere.
pay at that point, the price to pay is worth it to him. He's like, okay, well, I'm going to pay that price because my health is more important.
Exactly.
My care is more important.
Exactly.
And so sometimes what you're saying, ultimately, if we take it all the way back to the beginning, the culmination of where that decision is made at 65 is we can't predict the future.
Exactly.
And we know that, hey, we don't typically tend to get healthier as we get older. We tend to have more issues and more challenges, and we have things that we can't control.
Right.
And so we need to have that outlook that let's hope for the best, but plan for the worst.
Exactly.
Essentially.
Exactly. And it's kind of comical. I can't predict the future, but I've gotten pretty good at being able to recognize patterns. And one of the patterns I have recognized is that the longer we go, the more statistically likely it's going to be that we're going to need health care elsewhere, not just through the VA. And I can say that as a 100% disabled veteran. Like I have those same benefits. And many veterans I talk to will openly admit that I don't want the VA doing certain things for me. And so, yes, while we can't predict the future, we're seeing it more and more commonly, though, that it's like you need to have it as a backup because your preferences are going to change down the road. You're going to need healthcare elsewhere at some point. It's just a matter of when.
Yeah.
So Adam, we talked a little bit about, turning 65, certain enrollment periods, getting penalized in the event that you don't enroll at the right time. Can you walk us through what the actual enrollment window looks like and what ends up happening if a veteran misses it? I mean, we touched a little bit on that already, but can you expand on that?
Yeah, veteran or really anyone, right? So the enrollment window for Medicare initially, it's called the Initial Enrollment Period. So for most people, that's going to be based on their age, based on turning 65, right? And so that window starts 3 months prior to their 65th birth month. It's the month of, and then 3 months after. So it's a 7-month period of time.
Okay.
Now, there's one little caveat to that, right? Whoever invented these rules and systems that we need to follow, I don't know if they were on the advisory board for Milton and Bradley, some of these people that invented games. But there's a little caveat to that, and that's if you're born on the first day of the month. So if you're 65th birth month, you're born on the first day of that month, your enrollment period, your initial enrollment period would actually start 1 month prior. So you'd set everything back 1 month, right? So for most people, though, it's going to be that 7-month window that starts 3 months prior, the month of, and 3 months after.
Okay.
And that's where we're going to want to make a decision on, should I take Medicare or should I delay it, right? And if I'm going to delay it, let's make a decision that's an informed decision based on what are the ramifications if I don't take it, right? Am I eligible to delay it, right? Because some people are, and that's sometimes the best decision for them to delay it.
And can you expand on that? I mean, what actually would quantify as them being able to delay it? What would they need to have? What criteria would apply there?
So we need to have what's called creditable health coverage, and that's going to be coverage from active employer-sponsored coverage. Now, that can be through a spouse, so maybe we're added onto our spouse's employer group plan. They're actively working, right, and I'm on their plan, right? Or vice versa, I've got my own plan, and I'm actively working. Now, we want to look, though, at the size of the employer. We want to look at how many people are on that plan. We want to have 20 or more employees on there typically. We always want to confirm with the HR department, make sure that it's deemed creditable, right? Measure twice, cut once, they say. Same kind of a concept here. Just double check, because we've seen some variance here and there. But that being said, active employer-sponsored health coverage. So the key here, that we have people that say, I have employer, or I have group coverage, you'll say. I have group coverage, but they retired from that company. So is that active employment? The answer is no. That's not deemed creditable. So there's little nuances in the words that we got to pay attention to. And that's why I think it really makes sense to just get clarity on your unique situation, because there's so many little moving parts and unique things we need to look at.
Right. And so we talked a little bit about that before, but it's safe to say, as you've mentioned, that the only way, right, to delay is if you have that creditable active employer coverage.
Right.
Safe to say that the VA, that's not creditable coverage, as we've discussed a little
Correct.
bit more about. That's why it doesn't protect veterans from that penalty.
Exactly.
Okay.
Exactly. Exactly.
If anything we covered today raised questions about your own situation, whether you are inside your enrollment window, whether you have the right coverage in place, whether there are gaps that you didn't know about, I want you to know that this is exactly what we do. My team works with veterans on this every single day. We've seen every kind of situation you can imagine: the veteran who thought VA covered everything, the one who missed the window and didn't know it, the one who had both and never knew how to use them together. Nothing surprises us. We've earned hundreds of 5-star reviews from veterans just like you. The link to our calendar is right in the description. So book a time, bring your situation. We have honest answers, and we're here to help.
So Glenn, walk me through what happens to a veteran, really, or I would say this relates to anyone. Again, that's why, with anybody, we really see veterans and just the general population that are navigating Medicare. But walk me through what happens if somebody decides to skip Medicare Part B for whatever reason. They decide to, and they end up in the ER.
Yep.
Right? And let me back up before you answer that. But I mean, these type of things happen. And these are, again, back to what we talked about earlier. These are things that we don't control.
Right.
Right? If you go into the ER, it's usually because you didn't plan for it. Right?
Emergency.
Chest pain. Maybe you collapse. Maybe the neighbor. Maybe the person says, "I'll never go to the hospital." All right, I can think of family members that they're like, "I will not go. Take me out back and dispose of me." But what happens if you collapse and there's somebody else around, a neighbor, a friend, a family member, and a good Samaritan? They're calling, and that ambulance is coming and picking you up, and you're going to the hospital. So in that situation, what's going to happen?
That's a great question. So it actually will go back to What is the emergency room stay and where does it fall under Medicare? And why is skipping Part B significant? Well, emergency care is considered a medical service, which falls under Part B of Medicare.
Which is, again, the part that somebody would potentially have some pain around I don't want to pay the price for it, so I'm just going to do away with it.
Exactly. And that's what I was going to say is that just like you mentioned, the only reason they wouldn't want to do it is because they don't want to pay for it. That's really what it comes back to. They don't want to pay for it. They don't understand how it actually works.
Mm-hmm.
And so people think that, oh, I'm going to the hospital. It's going to be under my Part A hospital coverage of Medicare. It's not. It's considered an outpatient service. Now, if they're there and they end up getting admitted, that's another story. But if they're in the emergency room and they're under observation, it's outpatient. It's Part B.
Mm.
So that fundamentally means that if they didn't take Part B, they have no coverage. Guess who's eating the entire bill? That person that went there, whether it's a veteran, as you mentioned, it could be anybody. A civilian that goes to the ER and they don't have that coverage in place, they're eating the whole bill. And I had a client who went there and just in 4 hours of being at the ER racked up over $10,000 in bills.
It's unbelievable.
It's wild.
And for the average person, that can really drastically impact them in retirement. I mean, we're not even going off it's not the weeds, it relates, but to the financial resources somebody's accumulated to retire on, right? To start living on. And somebody has to dip into those potentially in a down market, pulling money out, they're compounding their losses. And they say the number one cause of bankruptcy for seniors in retirement is due to an unexpected medical bill. Again, caveat to that. Emergency, right? Emergencies,
Exactly.
things that we don't plan
Unexpected.
for. Which goes back to, again, hope for the best,
Right.
but plan for the worst. Yeah,
Yep.
so that's so interesting, and it's unfortunate how often we hear that,
Right.
and the amount of times that we have had people personally that we've dealt with that have had something like that happen, and unfortunately, we're too late in talking to somebody that's specialized in something like this
Right.
to give them the information they needed to help them move forward in the way that's best for their situation. So
It is fortune favors the prepared. I mean, at the end of the day, that's why, again, you got to get the information in advance before you need to make that decision and actually understand what the consequences are of those decisions. Because again, like I said, they can have a lasting effects down the road. Seen people exhaust their life savings because they didn't get the information necessary to make a great decision.
and ultimately, not financially, that's unfortunate. But the other side of that is if somebody doesn't have Medicare Part B, which is, again, the medical portion you just described, there's a lot of providers that are going to turn them away in the civilian realm, say you don't have health coverage. I'm not even going to get paid 80%. I'm not getting paid anything. So they're going to turn them away and not get them the care they need. And at the end of the day, what's more important? I think having time, having health, right? Is that more important than finances? And I think that's something that is important to take stock of. Why are we doing what we do? Why are we making the decisions that we make, right?
Yep.
And look at what's truly important. So asking ourselves the question, is it more important to just keep a little bit extra money back? And I understand people's budgets are varying. Some people are on a very, very tight budget, but there's oftentimes things that can be done about that, right? To allow them to still have the health coverage they need and optimize that for their unique situation, right? And that's what I think a lot of people miss. They think, I don't want to talk to anybody that does this thing. Let me talk to a friend, a family member, a cousin, an aunt and uncle, somebody at the VA, somebody that's kind of on the out. They're not in that realm, and see what they're doing. Because these people will try to sell me something. They'll try to take advantage of me when really we just may end up getting the wrong information and make us feel good about they told me what I wanted to hear. Right. And so I make that decision, and now it's kind of their fault. Like if something goes wrong, like I can feel good in the interim until something bad happens. Where if we just talk to somebody that specializes and truly cares and wants to do what's right for that person, there can be things that are done about that, right? Helping it fit in the budget, make sure that we get the coverage we need.
Yep.
So
Exactly.
So that being said, so if the VA alone is not enough, and Medicare alone is it's not part of the VA system, it's totally separate. What does the right setup look like for a veteran or really anyone who's turning 65? Right? Because you got veterans and their spouses, and their situation could be unique.
It's a great question. So the proper setup, obviously, would be to have Medicare Part A and B in place as a backup, even if they go to the VA for all their health care. Because again, we don't know when that could happen. Again, going back to the emergency scenario, you don't have Part B, you're going to be stuck eating the whole bill, especially if you don't get the claim filed quick enough to the VA. And then again, there's other factors with your actual VA benefits that can affect that as well. What level of care you can get at the VA or outside of the VA. And so the proper setup would entail at a minimum having just Part A and B as a backup. That way, even while you're getting the care through the VA, you have this ability to go outside and see effectively whoever you want in the event your needs change, or maybe the VA doesn't have a specialist for you. So that's the starting point. I would say that's the foundation, is to have Part A and B in place at a minimum when you turn 65.
But correct me if I'm wrong, not everyone's going to need to do that, right? We kind of just talked about that, and it depends on the unique situation, right? So some people may be able to delay, and it may be in their best interest. But what does an optimal setup look like for somebody that doesn't have the ability to delay without a penalty? And your answer to that is really just making sure that we do take Medicare, get it as a backup in place. And correct me if I'm wrong, the VA's official stance, publicly stated on their site, is it a veteran take all form of health care available to them? Is
That's
that
correct. 100%
Correct?
correct. And so real quick, just want to run back just a second. You brought up a great point. It is individual, right? Everybody's situation is unique. So at the end of the day, you need to verify. If you're not sure, you need to verify your situation, right? Figure out where you fall, what category you're in. And to that point, if it is just VA, you don't have the ability to delay your Medicare. And the VA stance is very clear. It's actually on their website. So despite the information you get from, say, a VA advocate, a VSO, which again, they're well-intentioned, but they may not understand what the VA's public-facing stance is on whether or not veterans should enroll in other health care. But on their website, they make it very clear they should enroll in all forms, not just Medicare, not just A, not just B, all forms of health coverage that they have available to them. Why? Because they don't want them to be restricted to only being able to get their health care at the VA. They also understand that things change. You may get a new doctor assigned that maybe he's really disrespectful. You don't like the way he talks to you. And if that ends up happening, you're probably going to want to go see someone else. The problem is you can't just go and do that with the VA. You can't change your doctor because you don't like how he talks to you. You can't just change your doctor. You have a whole care team assigned to you. And so you can complain about it, but it's not going to necessarily fix the problem. So what do you have then as a backup? Well, if you don't have Medicare, you have nothing, right? And so that's why it's important to recognize that the VA stance, that's why they feel that way. They want you to enroll.
And when it comes to having Medicare as a backup, we have the ability now to go outside of the VA, see civilian providers, right? And if we set Medicare up properly, and I want to put that little disclaimer, if we set it up properly based on our individual situation, right? Because everybody's situation is different. What's right for one person might be totally wrong for the other person. We've seen it even in the same household, right?
Yes.
So if they set things up properly, now they have the ability, they go to Dr. A, and Dr. A is talking to him the same way the doctor at the VA is. And they're like, you know what, this guy, I don't like him. This gal, I don't like her. And I'm going to somebody else.
Right.
Boom. You're going to somebody else. Nobody's telling you what you should do, can do, did do, would do. You're going and have that flexibility.
And you have to have Medicare in order to do that. Right? You have to have that flexibility because Medicare itself doesn't have a network. So there's no waiting around for referrals. There's no waiting around for, as of right now, prior authorizations. And when that means that you have the flexibility to go wherever you want. Again, you don't like the doctor? You go and schedule an appointment with another doctor's office or another doctor in that practice or whatever you want to do. You have the choice, the freedom of choice. So really, that's what it comes back to, right? Having the ability to decide how you get your care and when.
So just to confirm, who the veteran, the spouse, or somebody who maybe is not a veteran, again, just to confirm, what's the legitimate reason to not take Medicare Part B?
The legitimate reason would only be because they have other qualifying health coverage that would allow them to delay their enrollment into Medicare. Again, qualifying health coverage comes from an active employer. Large group employer, right? More than 20 employees, as you stated earlier. Obviously, they should always verify that.
Right.
But nonetheless, what we're also seeing now in that space is that the majority of those folks are actually getting a better deal through Medicare anyway. So nonetheless, even if you do have the creditable coverage, don't just check the box and go, I'm good, I don't need to enroll in Medicare. Check to make sure whether or not it's the right fit. That's super important.
Because what's interesting on that front is the very person who would be considering not taking Medicare is considering not taking it because of the price.
Exactly.
And so if we just go, oh, I have creditable coverage, let me check the box, and I don't look at what I have and compare it to what's available, I may be actually doing the opposite of what I want to do, which is make sure that I'm getting something financially responsible for me at that point in time, right? Whatever's going to be fiscally most affordable, at the same time, the best coverage I can get, right? So the best value available to me at that time.
Exactly.
And we have been seeing that, right? More and more and more and more as employers cut back on benefits that are being provided. And that's seen in health coverage that's available. Premiums are going up.
Right.
Deductibles are rising. Max out-of-pocket limits are rising. Benefits are being reduced. Across the board, we've seen that.
Yep.
So that's a great point and something everybody should really take stock of. So that being said, someone watching this who, they want to make sure that they're not walking into any of these situations blind. What did you and your team put together for them? What did you and your team have available to be able to help those people?
Well, I think it would start with, again, getting to know their specific situation. Again, everybody's situation is unique. It's individualized. So figuring out what it is that they actually need to do is where you'd start.
Yeah.
Right? Do they have other coverage? Do they have the ability to get health care elsewhere? What level of coverage do they have if it's through the VA? And if they ultimately end up needing to enroll in Medicare, we can tell them exactly why that is and confirm that they understand the importance of having it as a backup, as we've already discussed all the different scenarios that would require that. But then there's additional programs out there that are available through Medicare, many of them designed specifically for veterans that would allow them to be able to achieve the same rights, benefits, guarantees of Medicare, and then also reduce what they pay for their Medicare premium, which is a huge factor for the majority of veterans of why they would not take it.
Right.
And so in some places, you're having veterans paying $20 a month for their Medicare. That's a huge, less than $20 a month in some places. And it's incredible. It's a federally funded program that allows them to have all the same rights, benefits, and guarantees. Now, that's not the right fit for everybody. As I've mentioned, it's individual insurance. You need to make sure that it's the right fit for you. How do you do that? You got to talk to an expert. You got to talk to somebody that does this for veterans across the country, right? And so with that, you're able to get all the same rights, benefits, and guarantees, and in many cases, additional benefits above and beyond what Medicare covers. And now you're paying less, and you have something as a backup. You don't even have to use it. That's the other thing. You don't even necessarily need to use it. You can just have it sitting there as a backup. That way, in the event something changes with your health situation through the VA or your preference, you have the ability to do so.
So you're kind of setting it as a backup and allowing it to be there and customizing it in a way that fits your needs right now at that point in time, which, hey, my need might be, I just don't want to pay the full price for it. I want to keep it as a backup in case I need it later. And then I could always make changes to it down the road.
100%. That is completely accurate. Yes.
But it all starts with step number one is let's just figure out what your unique needs are. You're saying, hey, have a conversation with you, your team, again, people that are actually other veterans, same situation as the people that might be watching, who know your situation, who understand it, who see it day after day after day. It's all they do, right? Start there, answer some questions about your situation to make sure that you get the facts, that you get the information that's relevant to your situation so that that person can make an informed decision, ultimately, that they're empowered to make their own decision based on facts, not based on hearsay.
Exactly.
That's powerful.
Yep.
And, what gets me is everything that we just talked about. It plays every single day. We hear more and more and more stories of people that have made mistakes, made decisions that weren't, best for their situation. And a lot of people are just giving veterans that are turning 65 and their spouses the wrong information. They're not getting the facts. And so we see that a lot. No roadmap, no warning, no heads up. And that's exactly why you've put this together for the veterans so that they can get the answers they need.
Exactly. Yep. And it starts with it starts with a personal one-on-one private consultation with a subject matter expert. Many of these experts that I've personally trained our veterans themselves, service connected, truly understand the veteran situation because they have those exact same benefits. Some of them are even turning 65 themselves this year. This is so they know exactly what they need to do.
Yeah.
And that's why they're so passionate about helping other veterans navigate this as well. We don't want our comrades, our brothers in arms, people that wore the same uniform, laced up the same boots that we did, going through this without the proper information. So again, it starts with a one-on-one private consultation where they can get a good understanding of the veteran's specific situation and can help guide them through that process on what they need to do.
And consultation sounds complex and long and scary. You know, how long is that process?
10 to 15, maybe 25 minutes at the absolute most.
So it's just a quick phone call.
Quick phone call.
Check in.
Tell us a little bit about your situation. Let us know what you're going through right now. What are you wanting to achieve as you enter into this next phase of life? Are you retired already? All these things are factors that need to be considered. And once they've figured out what their situation is, they can provide a formal recommendation on what they should be doing based on that situation. Ultimately allowing them to make a decision based on fact, from strength, a position of strength where they don't need to worry down the road, did I do the right thing? Looking in the rearview mirrors years down the road, did I do the right thing when I turned 65? They'll have the peace of mind. And guess what? Their family, their loved ones are also going to appreciate that as well.
So Glenn, for the veteran or their spouse or just somebody watching that's turning 65, what are 3 takeaways before they turn this thing off? What are 3 things they should take away from this segment here today?
Well, the first thing would be, what's your situation? Figure out, do you need to enroll in Medicare, right? Are you turning 65? Do you have other health coverage, right? I would say that's the biggest thing. You need to figure out.
So identify their situation.
Identify their situation. The second would be, that's my train of thought there. Talked about a lot.
3 things that any veteran, their spouse, or just anybody turning 65 should take away. What would you want them to know?
Want them to know that if they don't have proper coverage in place, they're going to end up getting penalized, right, permanently and lifelong. So that's part of, again, making sure they figure out their specific situation, where they fall, what category they're in. And then to figure out, in addition to Medicare, is there anything else out there they're going to need to make sure they're properly covered? Because when they go to use those benefits, it's not just, as I've already mentioned, pure coverage. There's gaps, there's limits to it all. Medicare has those same gaps and limits, which is a conversation for a later date for sure. But that is something they need to consider as well. What in addition do you need for Medicare? And the third is finding a team that actually understands your specific situation and can help guide you through that process, that specializes in it, not just your Joe Schmo off the block or down the road from you, making sure that the person that you're talking to understands your unique situation. And that comes from, again, having somebody that you can trust and rely on.
What you're saying is ultimately, I mean, in the world we live in nowadays, everybody is so connected digitally, remotely, virtually, if you will, anywhere in the world, information is transferred, business is transacted. Things are happening quickly, efficiently. And so no matter where somebody's at, in the country, it doesn't matter if they got somebody down the road now that says, oh, I do that thing. That doesn't make them skilled, right? Just because they're local based on a geography.
Right.
That person could have graduated at the bottom of their class, whether they were a doctor, a lawyer, or some sort of insurance professional or retirement professional. They could be like the bottom of the barrel, but just happen to be local, right?
Exactly.
So what you're saying ultimately is find people that specialize and do that thing over and over and over and over again.
Exactly.
Because that's what's going to allow you to have success and the best chance of getting exactly what you want, which is truth, honesty, and real education based on your unique situation.
Exactly. If today helped you, hit subscribe and share this with a veteran you know who's turning 65. This is the conversation that should happen before the Medicare card shows up. My team does this every single day. We've earned hundreds of 5-star reviews from veterans just like you, and the link to our calendar is right in the description below. I want to invite you to book a time. Bring your situation. We've seen every kind of situation you can imagine, and we have honest answers, and we're here to help.
Mission 65.
Get this right.
Medicare retirement, your plan.
Mission 65.
You deserve it. Mission 65.
Let's get it right.